Good afternoon, everyone, and welcome to today's COVID-19 update. Today we have Premier Jason Kenney via teleconference, Minister of Health Tyler Shandro via video conference, and Dr. Hinshaw here in Edmonton. And with that, I'll invite Premier Kenney to begin.
Thanks very much, Christine. First of all, sorry I can't be with you by video, but I am at home, and I'll explain why. Earlier today, I was informed that I have been in close contact with someone who has tested positive for COVID-19. And so as a result, I've been tested myself and I am awaiting for those results. But regardless of whether the results are positive or negative, I will, of course, observe Alberta Health guidelines by staying in self-isolation for 14 days from the close contact, which was on Monday. And that means I'll be in self-isolation working from home until November 23rd. Today, I want to update you on COVID-19 in the province and announce a new series of targeted measures to protect the health system and limit the spread. First, I want to put our current state into context. In the spring, our highest daily new case count at the peak was 351. The highest number of hospitalizations we had in the spring was 88, with 21 people in intensive care. Our current state is twice as high as those numbers, both in terms of new cases and hospital impacts as the numbers continue to grow. It's almost certain that we've not yet seen the peak of the current increase. Yesterday, we identified 860 new cases of COVID-19 in Alberta on over 15,000 tests. There are now 225 COVID-19 positive patients in hospital, 51 of whom are in ICU. There are 16 hospital outbreaks with active cases right now affecting 9 healthcare facilities around the province. The Edmonton zone has already had to postpone about 30% of elective surgeries as a result. Our rising community spread is putting our healthcare system under real stress. It's not just our hospitals that are being impacted. We were deeply grieved in the spring by reports of a continuing care outbreak that caused over 100 cases and 20 or more deaths. Right now, we have more than 50 active continuing care outbreaks, 3 of which have over 100 cases each. Operators and workers are trying their best to contain the spread and continue providing care, but the numbers are very troubling. The total number of active COVID cases in continuing care across the province more than quadrupled from less than 100 on the 1st of October to over 400 at the beginning of this month. The number of exposures at school also rises as spread increases across the broader community. And while the work of students, parents, staff, and teachers has been fantastic to prevent onward spread, there is an ongoing challenge as the numbers rise throughout the broader province. And we are at a dangerous juncture in our province. These numbers I've just shared add up to one unavoidable fact. The growing number of hospitalizations, ICU admissions, are challenging our ability to continue delivering non-urgent health services that Albertans depend on. And this, of course, affects everyone. It's not just an Edmonton problem or a Calgary problem. Currently, there are 55 communities in the enhanced measures status. While cases are rising fastest in our 2 largest cities, we're also seeing increases in many other towns and cities. The impact of the measures I announced on November 6th are only just starting to be seen, but we can't afford to wait. COVID-19 is challenging us, and we have to rise to this test. We have to bend the curve back down to support our healthcare system, to protect vulnerable Albertans, to keep schools open, and to avoid further damage to people's livelihoods and the economy at a time of great adversity. We've seen examples in some U.S. states, European countries, Quebec, and elsewhere of the impact that COVID can have when it overwhelms the health system. We must not let that happen in Alberta. Today, I'm announcing a series of targeted measures for the province that were decided on yesterday by the Priorities Implementation Committee of Alberta's Cabinet, based on the advice of the Chief Medical Officer for Health. They're intended to act as temporary, time-limited measures to help protect the health system and reduce the spread of COVID-19. These measures collectively are meant to reduce the number of close contacts that Albertans have with others in the weeks to come, to try aggressively to bring our numbers down. Some of these measures are specifically time-limited for the 2 weeks from November 13th to the 27th. The first and most geographically targeted of these measures is that starting tomorrow, we're implementing a temporary stop to all group fitness, team sports, and group performance activities in urban centers where spread is rising. This will apply to all such activities in Edmonton and surrounding areas, as well as Calgary and surrounding areas, plus Grande Prairie, Lethbridge, Fort McMurray, and Red Deer. Many fitness operators and sport organizations have done great work to make their facilities and activities safe, and I thank them for their effort. This 2-week pause reflects the fact that at this moment in the province, we need a pause on any activity that has a significant chance of spreading infection from one to many. COVID-19 is spread by close contact with respiratory droplets from someone who's infected. Group sports and fitness classes can cause a high risk of spread due to exertion where participants have a high rate of droplet emissions in enclosed spaces. Socializing may also take place before or after the activity, which we've seen as a factor in recent team sports outbreaks. We've seen several large outbreaks linked to group fitness or team sports in the past few months. To be clear, this 2-week activity stop applies to all indoor group fitness and sports. It does not include outdoor sport, individual sports like tennis, individual exercises, training, or equipment use. And it also does not apply to junior, university, or professional sports, as they have additional public health measures in place to limit the risk of exposure. Despite this pause in team sport and group fitness activities, I want to underline the importance of regular physical activity in both physical and mental health. I encourage everyone who participates in these activities and who is impacted by temporary measures to remain active during this time. Group fitness may be able to move to virtual delivery for the short time, and there may be options for winter outdoor sports. Similarly, the temporary stop on group performances is only in the cities and surrounding areas that I mentioned earlier. The group performances limits include group singing, dancing, and theater cohort groups. Although we have not seen significant spread from these activities, we know that when done in closed space with people in close contact, they can also cause spread of the virus from one to many. Like many sports organizers and fitness center operators, many theater, choir, and dance groups have done excellent work to keep their members safe. This 2-week pause is part of the temporary time-limited measures, and these activities will be able to resume soon. I know that these activities are also an important part of Albertans' mental and physical health, and I encourage participants to find ways to practice individually in the 2-week pause. The performance restriction does not apply to professional performance venues, as they also have additional public health measures in place. The second measure is more geographically widespread. Beginning tomorrow, all restaurants, bars, lounges, and pubs in areas that are under enhanced status with more than 50 active cases per 100,000 people must stop liquor sales by 10 p.m. and close by 11. I know that operators have worked hard to follow the guidance in place and protect their patrons. I thank them for their dedication and for their commitment to keeping their customers as safe as possible. But extended drinking and socializing in these settings, which primarily occurs very late at night, poses a risk for spreading COVID-19. Limiting the hours of liquor consumption and operating hours will allow these businesses to stay open most of the time. And let me stress that the vast majority of restaurants and businesses in the hospitality sector have shown great care and responsibility over these past tough months with very limited spread. Unfortunately, we've seen a growing number of violations where bars and pubs in particular have turned into virtual nightclubs. And I'll remind you that nightclubs are one of the few business activities that have been suspended since March for obvious reasons. And it's these growing number of violations that have created the concern and caused today's restriction. While helping limit the times where social mingling combined with alcohol consumption is most likely to occur, similar restrictions are currently in place in most other provinces. Thirdly, we are strongly recommending that Albertans living in any area under enhanced measures on our relaunch map not have social gatherings in their homes. Now, as you know, we made that call last week for Calgary and Edmonton, and we are now expanding that to all areas that are under enhanced measures. This must be taken seriously. We are putting our faith in the good judgment of Albertans, which is why these measures are voluntary right now. No one wants to have a government tell us how many people we can have in our homes. But the alternative to voluntary action by Albertans is mandatory restrictions, like in most other places, backed by fines. And if we continue to see large private parties that ignore these recommendations, we may have to consider enforcement action. 40% of the spread of COVID-19 can be traced to transmission at home and at social gatherings. I don't think it's unreasonable for people to suspend these kinds of gatherings for the time being, a measure that can turn the numbers around, help to protect the healthcare system without impairing businesses or jobs. If this one source of spread was to stop, we'd be in overwhelmingly better shape almost immediately. I'll just give you one example. I was talking to a friend, a business owner last night, who said that they've taken great care to follow all of the protocols. They've had all of their workers back at the workplace, no COVID spread, checking for symptoms every day, use of masks and hand sanitizers and barriers and spacing at work. So a model performance by this employer, but one of the employees who had been out at a poker night got COVID positive. Somebody who thought, they were just relaxed with some old friends at home, probably sharing some drinks and some laughs in close quarters, probably sharing the same snack bowls and everything else, got COVID positive at a poker game at someone's house and brought it to the workplace. That's how this is spreading in large part. And that's why we're asking Albertans to take this seriously. If you're an Albertan living in an area that's under enhanced precautions, you should not be going to should not be going to gatherings in other communities that don't have restrictions. That increases the risk of spread and puts even more people at risk. The social gathering limits applicable to the area you live in are the limits that you should follow everywhere. In addition to these limitations, we are implementing several other measures for all regions under enhanced status. And starting tomorrow, there's a 50-person limit on wedding or funeral ceremonies in all of these areas. We recognize the importance of these activities, the lifetime importance of them, and the challenge that this limit presents. But we've also seen a number of large outbreaks linked to weddings and funerals, given the proximity that happens, the intimacy of these events. And we need to take additional measures with community spread rising sharply. These events are inherently emotional, as I say, and they bring people together. It's challenging to limit close contact between attendees at these events. This mandatory 50-person limit will help to limit exposure at wedding and funeral ceremonies, reducing outbreaks, and protecting the vulnerable members who do attend. We're also asking that all faith-based organizations in enhanced areas limit the attendance at any worship or faith services to 1/3 of the room's capacity. And I want to thank all the faith leaders and communities that have worked so hard to limit the spread of COVID since it began. These groups have done amazing work in protecting their members and their communities. And I was talking to some faith community leaders about these potential restrictions, and they told me that because of the social distancing guidelines, they're all operating at less than 1/3 capacity at their places of worship already. The problem is not the vast majority of these communities. The problem is a small number who have been disregarding, in some cases flagrantly disregarding, the public health guidelines on worship services. And we have seen some spread coming from such communities, and so this is a call to them to take this seriously and limit capacity, or limit the gatherings to 1/3 of capacity. Finally, we're asking employers in areas under watch to reduce the number of staff in office buildings at any one time when possible. This may include implementing options like rotating schedules or enabling staff to work remotely part of the time. And I want to say many businesses, I think the vast majority of businesses of Alberta have implemented significant measures to enhance safety in their workplaces. I've seen that myself. And there is a strong workplace safety culture in Alberta, and the vast majority of employers have not seen spread or problem. Unfortunately, we still have seen a significant number of cases emanating from office places, and so this is a call for managers of those places to take this very seriously. For all other areas of the province, all existing guidance and legal orders continue to remain in place. Please do your part to keep limiting the spread in your community. Dr. Hinshaw and I both spoke yesterday to people from some of the sectors that these measures will impact. I know they'll be very hard for many people, and we are sorry for that impact. These decisions, however, are not made lightly. It remains true that minimizing the impact of restrictions is as important as minimizing the impact of COVID itself, but COVID is starting to win, and we cannot let that happen. I want to stress how important it is that we all seize this moment. I believe in Albertans, and have said that we'll give them every opportunity to do the right thing and to reverse the dangerous trend that we are seeing and that is threatening our ability to deliver important healthcare services. This 2-week push is, I believe, our last chance to avoid more restrictive measures that I and most Albertans desperately want to avoid. If we focus our efforts for the next 2 weeks and embrace these common sense measures, we can reduce the spread and protect our hospital system. It'll take us all making sacrifices and going that extra mile every day in every part of our lives, but by working together, we can all protect each other, reduce the spread, and lift these measures as soon as possible. Thank you. And with that, I'm going to hand the mic over to Minister Shandro to discuss healthcare capacity, and then we'll hear from Dr. Hinshaw on today's Daily Update.
Thank you, Premier. And as Minister of Health, I want to assure Albertans that we are taking this increase in cases very seriously. As Premier has said, and as Dr. Hinshaw has noted previously, it's already impacting our health system. As a parent of young children, and as a son of 2 parents who are themselves senior citizens, I know how hard this pandemic is on families. As Minister of Health, I'm ensuring that the system can respond effectively. Edmonton Zone has postponed up to 30% of non-essential surgeries, which means hundreds of Alberta patients. And this is a difficult but necessary step. I understand the impact this has on our families and on our neighbors. If we're not able to bend the curve, rising rates of COVID cases may have more impact on scheduled surgeries and other services in the days ahead. We're working to prevent this from happening. Our public health teams are working around the clock to protect Albertans and limit the spread of COVID-19. We continue to expand our contact tracing capacity. Alberta now has posted 425 new positions to hire to the contact tracing team. Remembering that we started before the pandemic at 50, now at 800 and some contact tracers. We aim to have more than 1,100 contact tracers within a few weeks. AHS is also announcing a new online portal that will allow automated texting of close contacts. COVID-19 continues to affect our lives. It continues to affect our health system. As we work together with AHS to deploy innovative approaches and support their hiring of new staff, we need all Albertans to do their part. We all need to follow the temporary, time-limited measures that take effect tomorrow that Premier mentioned. The impact of the pandemic from here depends on us. How much we limit our contacts and follow guidance on physical distancing, masking, hand hygiene, and staying at home when we're sick. We also continue to encourage Albertans to download the AB Trace Together app, which provides our contact tracing teams here in Alberta with another source of information when working with Albertans to identify close contacts. And as Premier said, COVID-19 is challenging us, but no province is better at rising to a challenge. Alberta has one of the finest health systems in the world, we're taking every possible step to protect each other from COVID-19 and ensure that the system will be there for everyone who needs it. Thank you very much. I'll now ask Dr. Hinshaw.
Thank you, Minister, and thank you, Premier. And good afternoon, everyone. Before I get to today's numbers, I want to thank and recognize the many people who are working very hard in challenging settings right now. We have seen large increases, as you've heard, in active cases in continuing care and in First Nations communities over the past few weeks. And there are many, many people who are doing their best to prevent further spread in these settings. Workers in long-term care settings are going above and beyond to care for residents with complex health needs, to support those with COVID, and prevent spread to others. I also want to specifically acknowledge the health teams and leadership in the Siksika First Nation and the Saddle Lake Cree First Nation, where cases have recently increased quickly. I want to be clear that First Nations communities across the province, including these two, have done a remarkable job in protecting their communities and preventing spread. Their current numbers, like the numbers in the rest of the province, are simply a reflection of how interconnected we all are, and that rising transmission in our province impacts all of us. No group should be targeted or stigmatized, particularly not when communities are being transparent about their challenges and working incredibly hard to bring spread under control. We must all support each other, which includes supporting healthcare workers, continuing care workers, and public health workers in every community across the province. As another example, I want to acknowledge Albertans and our contact tracing team, who together notified more than 43,000 close contacts last week from November 6th to 9th alone. Thank you to those Albertans who were cases or contacts and who worked with the contact tracers to prevent further spread. We have to keep this effort up. Together with limiting our close contacts, maintaining physical distance, masking, and staying home when sick, the efficiency and completeness of our contact tracing efforts is critical to stemming new cases in Alberta. Today, AHS is launching a new online portal that will allow for automated texting of close contacts. This tool will further support Albertans and will help speed up contact tracing. Albertans who receive a positive COVID-19 result will be able to visit a new online tool on the AHS website, enter information and phone numbers of known close contacts, and submit this information. Once reviewed by the contact tracing team, including with the case, the tool will then send texts informing close contacts of their exposure and instructing them to isolate immediately for 14 days. It will also provide a link to further information on isolation requirements, testing options, symptoms, and supports available. This process will be completely anonymous. The name of the positive cases will not be disclosed in these messages. It will, however, help increase our capacity and speed in this notification process. Turning to today's numbers, as the Premier said, we have identified 860 new cases of COVID-19 in Alberta, which raises our active case number to 8,300. There are 225 people in hospital, including 51 in ICU. When looking at all of our rural zones combined, we have crossed the threshold of 5% average daily hospital growth over 2 weeks. As of today, we are sitting at 7% average daily growth in the rural zones over the past 2 weeks. This week, as you know, we also hit the trigger of more than 50% of our COVID ICU capacity in use. We are currently sitting at 73% of those 70 beds. As the Premier has said, this is deeply concerning. In schools, there are currently active alerts or outbreaks in 307 schools. That is about 13% of schools in the province. Currently, these schools have 1,031 active cases in total. This number includes 62 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 141 schools. Of these, about half had only one new case as a result. Schools continue to mirror the rise in transmission that is being seen in our communities, and this community transmission rise is putting them at risk. Sadly, I must report there have been 10 new deaths. My thoughts go out to everyone who has lost a loved one during this difficult time. This is yet another stark reminder of the deadly potential of this virus and why we must take steps to reduce community transmission. As the Premier said, the rising hospitalizations and ICU admissions are threatening our ability to deliver health services and support Albertans' overall health and well-being. We must reduce the growth of COVID-19, and we must do it soon. I know that these measures will be challenging for many people. I had the privilege of speaking with many people from some of the sectors that these new measures will impact, and I know this next while will be hard for many. I want to thank those business leaders who will be impacted by these measures, but who are working with us to make sure activities are even safer when reopening happens. I want to reiterate the importance of finding other ways to be active in the next 2 weeks for those whose fitness or creative activities are paused. And at the same time, every one of us must do our part to embrace the measures that the Premier just announced. If you live in an area with enhanced measures, we need you to take action immediately. Please limit your social interactions with friends, extended family, and others outside your household wherever possible. Please do not have anyone who doesn't live with you over to your house for any non-essential visits. To be clear, this does not apply to blended families or shared households. It simply applies to non-essential visits in homes. These visits should not be happening right now. If you can start meeting friends or family members via Skype or Zoom, please start today. Now is the time to reduce the number of cohorts we are in and make changes to our lives to make it less likely that we will be exposed to COVID-19 or pass the virus to others. We are all in this together, and we must face this challenge together. Thank you, and we're happy to take any questions.
Okay, before we get the Q&A started, I'd like to just remind the media on the line that we have a lot of you waiting to ask questions, so please limit yourself to one question. Operator, please put through the first caller.
Yes, thank you very much. The first call is from David Staples, Edmonton Journal.
Thank you. Some of these measures have been tried in other provinces, limiting the hours of service at restaurants and bars in BC in early September. In Ontario, they brought in stricter measures in early October. These measures aren't as strict as many of the measures we've seen in other provinces, yet their numbers have grown. Do you think we're doing enough here to stop the spread?
Well, I'm not sure that's directed to David. The Premier here, I'll take the first effort at it, then perhaps refer to Dr. Hinshaw to say, yes, that we obviously are moving forward because the increase in cases is undermining our ability to deliver health services, particularly in Edmonton and Calgary. And we think it's necessary at this time to bring in limited, focused, targeted measures that reduces opportunities for viral spread without imposing significant broader negative impacts on our society, on lives and livelihoods. I appreciate that Dr. Hinshaw has come to our cabinet with a series of measures that we will implement now that we think are balanced. And these are based in part on observations of what has been effective in other jurisdictions. With that, I'll invite Dr. Hinshaw to complement that.
Thank you, Premier. I would just add that the opportunity for these measures to be effective rests in Albertans' hands. We know that many people are tired of restrictions, and we've heard that many people are feeling a lack of hope. And so what we want to do is to really focus efforts for the next 2 weeks and encourage all Albertans, particularly those who live in areas where we have seen that increased spread that are under the enhanced measures. We want to encourage all Albertans to go above and beyond, look at these measures and embrace them for 2 weeks, because if we can put a dedicated effort into reducing our close contacts, to distancing, to masking, if we can do all of those things together, that is the opportunity to have these measures make a difference. It really does rely on everyone, all of us, stepping up and changing what we do and using all of our energy to try to make this change in this time frame. And you're quite right that unfortunately, if that's not happening, that the spread continues, we will have to be looking at other measures.
Operator, can you please put through the next caller?
Tyler Dawson, National Post.
Hi, I just wanted to ask about a tip that some of us have got, I think, about ERs being over capacity and some ICUs putting adult patients into pediatric beds and things like that. Just looking for some information and comment on that.
Refer that to Minister Shandro.
Thank you, Tyler. And we can get further information for you from AHS. It is their facilities, but Edmonton zone has been at 130% capacity. A big part of it is issues with folks who have to isolate at home, whether they are sick themselves or a close contact, or whether they have children who are close contact and have to isolate. But we will get you the further information from AHS. Thanks, Tyler.
Operator, can you please put through the next caller?
Carrie Tate, Globe and Mail.
Are you there?
Carrie, your line is open.
Sorry about that. Hi. This is a question for Dr. Hinshaw. How are hospitals dealing with staff shortages that's putting that extra pressure on hospitals that are already full of patients, where you have people isolating or are homesick?
The staff shortages are one factor in considering that overcapacity issue, and of course that is putting a tremendous amount of pressure on hospitals, on acute care. It's a similar issue in continuing care, quite frankly. And so that's part of the reason why in acute care there are pauses to non-urgent surgeries and non-urgent care needs, because exactly that where there are staff shortages, staff need to be reallocated to work in the areas with the most critical need. But ultimately, it goes back again to this need to have all of us chip in and turn the trend of our community transmission, because that is the only way that we will be able to prevent our health system from being overwhelmed. And of course, part of that is the healthcare workers who are either ill, close contacts, or caring for a sick family member.
Operator, can you please put through the next caller?
Don Braid, Calgary Herald.
Two questions. Premier, you're home again. This is your second bout of isolation. Are you, could I ask if you are hopefully not symptomatic, and when will you get your test? And the second question regards some of the measures in lower mainland of BC, which are much tougher. They're basically ordering a kind of shutdown of all gatherings, and especially not allowing anybody to go to receptions for funerals or weddings. So I'd ask if you think we might need that, or respond to that as well as your own situation, if you would.
Sure. Thanks, Don. So I'm feeling fine. I don't have any COVID-related symptoms, and was tested earlier this afternoon. Not sure when I'll get results back, but we'll make those public when they do come back. In the meanwhile, I'm self-isolating, and our protocol is for anybody who has been a close contact of somebody who is a confirmed positive for COVID-19 to self-isolate for 14 days from that close contact. And just to be clear about, we define a close contact as having been within 2 meters of somebody who's tested positive for COVID-19 for more than 15 minutes. And in particular, during the critical 48-hour period prior to them exhibiting symptoms. So I fall within those parameters, and therefore will be self-isolating until Monday, the 23rd of November, working from home. On your second question, we obviously are closely following the policies of other jurisdictions, and it's true that Alberta and British Columbia have been, I think, most closely aligned in our COVID approach, and quite closely aligned in our outcomes as well. Generally speaking, Alberta and BC have taken an approach more focused on personal and collective responsibility, public education, as well as, of course, things like robust, in the case of Alberta, robust testing and contact tracing. And through most of the last 9 months, we did very well by Canadian, North American, and metrics across the Western world. But obviously, BC in the Fraser Valley region right now is facing a spike in cases, not dissimilar to what we're experiencing in Edmonton and Calgary in particular. So we're taking note of their recent package of measures from their Chief Medical Officer, Dr. Henry. And let me, as I said in my opening statement, it's no secret that I do not want to take an approach that restricts people's fundamental rights and freedoms, their ability to gain a livelihood. I'm concerned about the broader social and health impacts of those things. However, if Albertans do not respond in a significant way over the next 2 weeks, we will have to consider additional targeted restrictive measures, and those would be what they've done in the Fraser Valley region would be on the list of things that I'm sure Dr. Hinshaw will be analyzing. Dr. Hinshaw, do you want to respond to that as well?
I think you've covered it, Premier, which is to say that there would be several things we'd be looking at if our case numbers don't decline, and of course, looking to learn from other provinces in their experience.
Operator, can you please put through the next caller?
Thank you. Jeff Slack, 660 News.
Hi there. This is for the Premier and I guess also Dr. Hinshaw. Just to follow up what you guys said at the end there, what do you need to see if to enter, say, the circuit lockdown? I know that you talk about more restrictive measures, but what is it that you would need to see to consider possibly another lockdown?
Well, I would first of all say we've never had a lockdown in Alberta. I would define a lockdown as policies that include the suspension of the operation of most businesses, that include shelter-in-place, stay-at-home orders, and that only permit people to circulate for essential reasons, the kind of policies we've seen in the Australian state of Victoria, that we see in some European countries now. We've never come close to that in Alberta, and we haven't had to come close to that. Having said that, we've been clear as a government that our primary goal is to protect the healthcare system, to prevent it from being overwhelmed, and that requires controlling the spread of the virus, but doing so in a way that minimizes the negative impact of restrictive policies. And so this is something that we calibrate based on the data, and that's why we're taking these measures today. In other words, I think the only circumstance where we would consider those kind of extreme lockdown measures, which are deeply damaging to people and to entire societies, is if we saw growth reach a point where it was fundamentally threatening the capacity of our healthcare system to cope. We are not there now, but if we don't take action, the stress on the healthcare system will only continue to grow, and then we would have to consider additional restrictive measures on a targeted basis.
Operator, can you please put through the next caller?
Yes, Rafi Boudjikanian, CBC.
Hi there. The question is for Premier Kenney. I'm actually going to ask two questions, if that's okay. I'm just wondering, when you say, if we see problems with the fundamental capacity of the system to cope, what are we defining as fundamental capacity problems? Well, we're already talking about, for example, ambulances being diverted from Greylands Hospital on a 24-hour period today. And my second question is, would you consider any closures of schools as Quebec is using right now?
On the second point, no, we don't feel that would be justified. there has been very limited evidence of in-school transmission, but as Dr. Hinshaw has said all along, cases in schools will generally tend to reflect wider community transmission. And so I'll invite Dr. Hinshaw to comment further on that. On the first question, I'll just remind you that in the spring, when we were concerned about the worst-case scenario, we had set aside about 2,400 acute care hospital beds in our system for prospective COVID patients, and we set aside about 650 ICU beds with ventilator support as well. Today, right now, currently we are at much smaller numbers than those, of course. We're at 225 hospitalizations, including 51 ICU admissions. So we're still at a relatively small fraction of what we demonstrated we can open up in terms of maximum capacity. And in terms of the, again, the schools, Doctor, would you like to answer further on that? Or?
Sure, yeah. I'll just comment that, when we were looking at the cases in schools and school-age children in particular, that it's a very small proportion. The last time that we looked at that specifically, it was about 6% of those school-age children who had acquired the infection in a school. So while we do see some instances of in-school transmission, the majority of cases it is just transmission from one person to one other person and not wider spread. And it does not seem to be the major driver of community transmission. I would say that schools provide a significant societal good with respect to providing not just an educational foundation, but also social development and the supports that many children need during a critical time of development in their life. And so I would say that that's something that we collectively prioritize as a societal good, and that it would be one of the things that we would want to preserve, even as we're looking at other measures that may need to be put in place.
Operator, can you put through the next caller, please?
Julia Wong, Global News.
Hi, this would be for, the Premier and Dr. Hinshaw. And firstly, a clarification and then my question. The clarification, how come we're just hearing for the first time about concerns related to spread in places of worship, sports, restaurants, and bars? And in particular for the latter, Albertans were told several times that these settings only accounted for 1% of cases. And then my question is, doctors say waiting 1 to 2 weeks to see the impact of new measures is time that the healthcare system does not have. One says the province could be out of ICU room within 2 weeks. Do we have the time to wait out these 2 weeks of measures?
Well, on the first question, you're correct, actually. The number of cases traceable to hospitality businesses is very small. We have identified 18 outbreaks over the past 9 months in hospitality businesses. That represents 0.16% of hospitality businesses. However, and let me just add to that, there have been 0 hospitalizations and 0 deaths traceable to an outbreak in a restaurant, bar, or pub. So while those numbers are encouraging, on all of these things we acknowledge that we are unable to trace the origin of about 40% of cases. So it's reasonable to assume that the number is slightly higher than that, but that's still to say that likely over 99% of hospitality sector operators have not seen an outbreak, and I think it would be devastating to punish their 174,000 employees when this has not been a significant place of transmission. Having said that, we do know that in that sector, we have seen a growing number of businesses that there's still a relatively small but still growing number of businesses that late at night have moved their tables out of the way and essentially turned into de facto nightclubs, which has always been against the restrictions. And so this is a measure that we are taking in partly to avoid that. We've consulted with the restaurant and hospitality industry. They are understanding of this measure, and we appreciate that understanding. In terms of faith communities, again, you're correct. We've seen, since the beginning in March, 10 outbreaks in the thousands of faith communities across Alberta, and recorded 6 hospitalizations and 3 deaths. So again, that there are areas that are of much greater concern, such as transmission at home and social gatherings. Having said that, there are a small number of faith communities that have disregarded the public health guidelines, and this is another way of reminding them of the importance of following those guidelines. And Dr. Hinshaw, do you want to complement that?
Sure. I would agree with what you've said, that it's a small proportion, that many individuals in the sports, fitness, hospitality industry and in faith settings have done really excellent work to keep their settings safe. But what we're targeting with the measures being announced today are essentially areas of risk. And we know that as community transmission grows and as our positivity rates increase in many places across the province, that when you have a group of people coming together, potentially engaging in activities like fitness activities, exercise, or singing, that those are the kinds of activities that can potentially cause spread from one to many if there is a bit of a deviation or a slip up in the protocols. So it's the majority of these settings, again, I think have done a really good job. But what we need to do right now, because of where our numbers are at, is we need to target the settings where there is that risk of large spreading events, both from what we've seen in our own province. And again, it hasn't been the majority of these settings that have had these events, but it is possible. And we're trying to put these measures in place, again, in a really focused way to encourage these operators to make these settings, again, to shut down those activities in this 2-week time period to limit the chance that we have these large spreading events.
Okay, we have time for 3 more. Operator, can you please put through the next caller?
Yes, Kieran Levitt, Toronto Star.
Hi, thanks for taking my question. This is for whoever wants to take it. We had one of the biggest pharmaceutical distribution companies tell us yesterday that the supply lines in Canada for delivering a vaccine are not quite strong enough, and specifically the promising Pfizer one that we just got some good news about. And they talked about how there's not enough storage capacity in things like deep freezes and ultra deep freezes. So I'm just wondering if anyone there is able to answer any questions about how Alberta plans to deal with this and distribution things generally.
Yeah, Minister Shandro.
Thank you, Premier. Thank you, Kieran. So yes, the procurement of vaccines and the distribution of it is done through the federal government. We'll be working very closely with them to make sure that these vaccine candidates that require cold storage, especially those who require extreme cold storage, that they will have the distribution network available to throughout the province here in Alberta. So we're happy to make sure that we're working with the federal government in time with the first tranche of the vaccines being able to be distributed here in Alberta, to make sure that that distribution network and any cold storage requirements are going to be there for the vaccines, especially not even just in Edmonton and Calgary, but for rural Albertans as well.
Operator, can you please put through the next caller?
Bill Kaufman, Calgary Herald.
Yes, hi. I'm just wondering if there's any measures that are considered or there might be considered in trying to really clamp down on where the major part of the spread is, and that is, in these private social gatherings. I'm wondering if the AHS or the Alberta Health Portal that was just announced could be used for that reason.
Well, Bill, Premier, I'll take that on. Look, as I said in response to Don Braid, we've taken note that British Columbia has taken a zero-tolerance approach to at-home social gatherings, including with fines and penalties. And as you know, we've tried to, we believe from the very beginning that buy-in from fellow Albertans is the most effective way forward as opposed to enforcement. But if there are still some folks who are going to flagrantly disregard the state that we are in, then we may have to take more stringent measures. We may have to look at potentially imposing a fine and empowering enforcement agencies to prevent large private social gatherings. That's not something I never thought I'd imagine an Alberta government doing, but we may be left with no choice. I've just heard from a source earlier today that some school boards are expressing concern that teenagers are getting together in large parties these days. That is causing spread that's affecting the schools. And so this is something we is very much on our radar screen. We today are like last week, we asked for no social gatherings at people's homes in Edmonton and Calgary. We're expanding that to all areas with that are under what we call our blue zone on the map. And if that doesn't work in the next couple of weeks, I think we're going to have to take stronger measures to prevent that kind of spread.
Operator, can you please put through the final caller?
Thank you. Yes, the final question is from Audrey Deveau, Radio Canada.
Hi, my question is for the Premier in French. Monsieur le Premier ministre, pourquoi est-ce que vous avez décidé de mettre ces mesures pour 2 semaines, mais de ne pas faire un confinement total pendant 2 semaines comme ces médecins l'ont demandé dans leur lettre ouverte?
Oui, merci. Nous suivons le conseil l'officier excusez-moi. Nous suivons le conseil de nos experts en santé publique à cet égard. Nous voulons vraiment communiquer l'importance de suivre les règles et l'approche de l'Alberta pendant les 2 prochaines semaines. C'est essentiel. Malheureusement, si nous ne voyons pas une diminution des nouveaux cas et si nous voyons une augmentation des nouveaux cas qui menacent la capacité du système de santé, évidemment, il faudra que le gouvernement prenne les actions supplémentaires. Mais je crois qu'en partie, le conseil de Dr. Hinshaw, avec lequel je suis d'accord, est qu'il faut avoir la volonté des Albertains à suivre les règles. Et pour donner un sens que ça va continuer pendant les mois et les mois, aura pu diminuer l'acceptation des Albertains pour les règles. Alors, il faut donner les gens les buts concrètes pour l'action, et c'est les raisons pour lesquelles on a mis en place une limite de 2 semaines pour certaines mesures.
That concludes today's Q&A. Dr. Hinshaw will be back with another update on Monday.